Well, here we find ourselves again. A lot of the same beautiful faces, hopefully some new ones who are joining us for our annual photo op, but also a very special time to bring awareness to such an important um, issue of heart disease. And as we do this time every year, we come together for the 2026 this year Go Red Day um, and have a heart to heart about heart disease. Obviously, this year we are always excited to share and give testimony and educate. And as you will see, as we get further into our agenda, we have an extra special guest this year who is joining us and sharing information and telling his story. So we will get to that. But again, we want to welcome you all for this day and certainly want to acknowledge our partners as we go through today's agenda. Thank you, Councilman Will Brennan, who's here, Councilwoman and Mayor Pro Tem Tina Herbert, who's here. We've got Chief Holbrook as part of our program guest, Lizzie Tankersley, the Executive Director for the Development and Community Health portion of the American Heart Association, Jacob Evans, and I know a lot of other Prisma family, but Jacob is the administrator for Prisma Heart and Vascular Institute. And someone I'm sure y'all know behind this, Connor Shaw, our famous quarterback and now father and founder of HRTHUDL. And again, we will get started this morning too with a special video message from our mayor, Daniel Rickman, who gives his regrets to not be able to be here in person this year, but he certainly wants to express his support. And come on in, Councilman Sam Johnson as well, who's here for our special presentations today. So with that, we will start with our special video message from Honorable Daniel Rickman. Right now, we'll move forward with our proclamation presentation to designate today as our Go Red Day for 2026. And with that, I will turn it over to Mayor Pro Tem Tina Herbert.
Thank you, Ms. Wilson. I'm learning my duties as Mayor Pro Tem, so I'm gonna, how did you say, Daniel? Project?
Just
amplify.
I'm gonna
be amplified today. All right, and this is a great honor. Thank you for the ability. Thank you all for coming out. I'm really excited. I've been coming and we've been coming for years, and it's always great when we can show consistency. You know, we have some folks that start stuff and then they stop, but this has been a consistent project that we've worked with at the city, and I thank the city for that. So, whereas cardiovascular disease affects men, women, and children of every age and race in the United States, from 2020 to 2021, deaths from heart rate disease increased by 3.3%, the largest increase in heart disease deaths since 2012. And stroke deaths increased in the same period by 5.9%. About 697,000 people died from heart disease in 2023. That is 1 in every 5 people dying from heart disease. Cardiovascular disease continues to be the leading cause of death in the United States. Whereas income disparity is a factor in heart disease rates in South Carolina, along with other social determinants of health. People with lower incomes have higher health risks for cardiovascular disease. Whereas women, especially Black and Hispanic women, are disproportionately impacted by heart disease and stroke, and research shows heart attacks are on the rise in younger women. Yet, younger generations of women, Gen Z and millennials, are less likely to be aware of their greatest health threat, including knowing the warning signs of heart attacks and strokes. Because of the significance of heart disease, we want to, Mayor Brickaman will declare today, along with my fellow members of council who are here today, we are proclaiming February as National Heart Month in Columbia, South Carolina.
You want to do a quick photo op? Thank you, Councilwoman. Thank you, Councilwoman Herbert. We will ask now, as Lizzie was just receiving on the proclamation, for her to also come forward for remarks. Lizzie Tankersley, the Executive Director of Development and Community Health with the American Heart Association. And I want to say personally to Lizzie, the Councilwoman talked about consistency. That is so important when we have consistency with our partners. And so many of you are here in the room today. It makes such a difference because community sees that. They see that we as a community, we are in this together. So glad to welcome Councilwoman Richard Barron Cooper here with us today, and her husband, and their support and her efforts with Richland County. I know she's will announce any events she's going to have, but she's also very instrumental during this time of the year bringing awareness. But again, it's a partnership, and Lizzie with AHA has been that consistent face and voice with us for many years.
Thank you. Thank you, Teresa. I appreciate that, and it's an honor and a pleasure to work with the City of Columbia, Richland County, all of our community partners. We can only accomplish what we do because of all of you, so thank you. Good morning, everybody, and happy National Wear Red Day! You all look so lovely and wonderful today, and across the country, people are wearing red today to raise awareness and spark education about heart health in women. So heart disease remains the #1 cause of death for women in the United States and is the #1 killer of new moms. Also, women are far less likely to receive bystander CPR. So today we all wear red for our mothers, our grandmothers, our sisters, our friends, and for us ladies, ourselves, because losing even just one woman to heart disease is one too many. And so as a heart disease survivor myself, I want to personally thank you. Thank you for showing up, for standing with us, and for supporting our mission year after year. Because of people like all of you, countless lives, including mine, are saved every day. So while today is a celebration of women and survivorship, it also marks the kickoff to American Heart Month. And throughout February, we honor survivors. We share stories of hope, and we empower people with the knowledge and the tools that they need to understand their risks, to care for their health, and to protect their families. This year's Heart Month theme is "You are the first responder until help arrives." So at the core of this 2026 concept, it's a transformative idea that in a cardiac emergency, the first responder is often not a professional in uniform. It's an everyday bystander. Cardiac arrest can happen anywhere. It can happen at the gym, in the grocery store, or on the sidelines of a child's football game. Yet more than 65% of Americans recently reported that they would feel helpless in the event of a cardiac emergency. So our message is simple and urgent. You do not need medical credentials to save a life. What you need is knowledge, courage, and the willingness to act. This campaign challenges all of us to see ourselves as empowered change makers, ordinary people with the extraordinary power to give someone another tomorrow. "You are the first responder until help arrives" is more than a slogan. It's a call to action. It's a civic responsibility, and it's a reminder that our communities, like the City of Columbia, are strongest when we are willing to step up and support one another. So now I'm going to pass it back to Teresa, but I thank you all again for celebrating today. It is important, and we need you, and we appreciate you.
So Lizzie has teased and even said the theme, and you're now going to understand even more about some activities that will be coming up that carry on that theme, but it all starts with the survival story we're here today and how we're going to come together to really bring this call to action to fruition with actual things that we can do together. I want to welcome Jacob Evans, the administrator with Prisoner Health Heart and Vascular Institute. Jacob will give remarks, and upon closure of his remarks, he will welcome our survivor story this year, Connor Shaw. Jacob?
My name is Jacob Evans, and I am honored to serve as the administrator for the Heart and Vascular Institute at Prisma Health. February is always a special month for us because we have the opportunity to highlight our folks who year-round dedicate their lives to making a difference in our community and our patients' lives. Just last night, I was joined by Kim Wallace, our nursing director for the Heart Hospital, to celebrate the 20-year anniversary of the Heart Hospital. What was special about that for us was not the brick and mortar building that's been there for 20 years. It was the show of hands that we saw when we asked how many people were there at the start and that were still there today. What makes us different is our people and our folks across the community, like the ones that we're joined with today, and our clinicians who are striving every day to make a difference through innovation and care delivery to our patients who need us the most. And so it's always very special, and especially having the opportunity to introduce somebody like Connor Shaw is something of pride. Connor is well known for his prowess as a professional athlete, but the more you get to know him, the more you realize that he's built a strong professional career engaging with community partners and healthcare organizations that are mission-driven. Today, he's here to talk about how he's galvanized those experiences and really brought them together, with the most powerful personal purpose you could have, his why. And today I'm just beyond proud to be able to introduce him and his new organization, the HRTHUDL. So, thank you, John.
So Connor didn't know about this part, but come on up, Connor, and that's right before you get started, we just had to do a little something. Hold on.
Uh-oh.
Hopefully the sound's gonna work. Give it a second.
Listen, this is the only shade of red I own, which I think is okay here in Columbia, South Carolina. Go Gamecocks. First off, I'm grateful to be here, thankful for the invitation. Anytime I get an opportunity to speak in front of people, I don't take it lightly. I pray on it. This certainly hits a little different for me. Everyone here, I think, has a story related to heart health. And my story happened about 5 months ago. And I'll get through this first part the best I can. September 17th, I was coaching my son Decker, his 8-under flag football game in Simpsonville at Gracely Park. And about 5 minutes into the game, I was on the field, called a play, ran a play, started feeling a little bit dizzy, nauseous, about 20 seconds of symptoms, really couldn't identify what was going on, never experienced this before. I can remember making my way over to the sideline to talk to our assistant coaches to say, hey, here's a playbook, you're gonna have to call it. And then I turned around and I dropped. And that was the last thing that I remember before falling onto the field from sudden cardiac arrest. Fortunately for me, I had 2 courageous bystanders that were coaching their sons on the field next to me. It's the only reason why I'm here today, able to share my story. We all know the stats, and I'll get into a little bit of that, but I was at Gracely Park, which was attached to Simpsonville Fire Department that was equipped with an AED. I'll say this, that AED was worthless without Caleb Carter and Zach Moore, who recognized my situation and jumped into action, just like Lizzie was talking about. It takes courage, courageous people, and they just happened to be off-duty first responders. So Caleb Carter is a rescue lieutenant at Simpsonville Fire Department. Zach Moore is a police officer there at Simpsonville. And they jumped into action, recognized what was going on, and they rotated CPR for 5 minutes until an AED arrived, which gave me another chance at life. I was shocked by the AED 3 times once I went into VFib, and then received a cardiovert in the back of the ambulance going to the hospital. Now, I can remember bits and pieces of that day. I was in and out of consciousness. I can remember seeing blades of grass and the sensations of the compressions from Caleb, who was on top of me. I remember hearing the sound of the golf cart pulling up behind me. I can remember my wife's voice as she was holding my head when they were doing CPR. But, you know, that's not as traumatic for me as it was for my family. My wife was there, my 11-year-old daughter was there, my 8-year-old son, my 2-year-old son, and my wife was 9.5 months pregnant at the time. So you can imagine the kind of situation, not to mention, you know, all the little kids and everything, and the other parents and coaches comforting my kids. And truth be told, they didn't know what was going to happen to their dad when I was putting them back in the ambulance. When I got to the hospital and stabilized, I got care at Prisma, so super thankful for the nurses and the surgeons and doctors for their discernment and for what they do every single day. But I spent 3 nights in the hospital, had surgery, received implanted ICD that monitors electrical pulses to my heart, and had a lot of emotions, you know, fear, confusion of what just happened to someone who's metabolically healthy, and certainly fear of what happens next. And probably the strongest emotion was anger. You know, angry that I had to live with a device for the rest of my life, and there wasn't any sort of definitive underlying health conditions or why this happened. So my natural instinct was, why is this happening? You know, why am I put in this position? And those emotions disappeared. When, excuse me.
Yeah, just take your time.
You want to play that video one more time? Those emotions disappeared when I went home and was met by my 3 kids. Thanks. And they hugged me. The only emotion I felt was gratitude. And quickly felt that everyone should have the same chance to survive that I did. And that everyone should have the same chance to go home and hug their loved ones, period. And so those next 2 weeks were difficult. I was an emotional roller coaster. We talked about it as a family, wanted to make sure my young kids knew what happened. We didn't want to suppress any sort of emotions, ask them questions. What did they learn, or what did they see from that day? Did they have any questions? And what to do from here? You know, I'm a person who is faith-driven. And hearing all the stories of people reaching out, similar to mine, also heartbreaking stories of a loved one passing away, and the stats of 1 in every 10 people survive, where I had to be there at Graceley Park, who had to be there to give me a chance to survive, there's no doubt in my mind that Jesus was super intentional with this. And I'm not saying that he creates bad events or good events, but I think he gives us an opportunity to respond and to lean into him. And so when I heard that story, those stories, and those questions pondering purpose, I quickly went back into quarterback mode, into mission, what's the next playbook? And it was to create a nonprofit called HRTHUDL after learning that so many people experience cardiac arrest or a family member cardiac arrest or heart disease or heart health in general. And so what you see up here today is our mission. I created HRTHUDL really just to celebrate another survival story. To me, it's pretty black and white. How can we equip our communities to respond to sudden cardiac arrest, period? And just like Lizzie said, you know, you don't have to have a CPR certification to save a life. If you know how to do CPR, hands-only CPR, you're inevitably one day might be in a position to save a life, right? And then also you see in that program that we equip Parks and Rec, emergency vehicles, some businesses with AEDs. The whole goal there is to evaluate the areas of need and do the best we can to place it there. I mentioned this happened about 5 months ago, and I didn't have much of a reason before my incident to understand this space, and it is a big space. We've already talked about how many cases this impacts per year, how many deaths. But here's what I've learned the past 5 months. 1 in every 10 survive. That's a 10% national average of survivability for sudden cardiac arrest. And that has not changed for decades. And it's not for the lack of deployments of AEDs in public places, and that is a very positive thing. I was saved by one. But what I've also learned is that 70% of cardiac arrests happen at home. They happen in residential settings, right? So then it becomes, how quick can we respond to those incidents, right? The way that we move the needle on 10% is to target where they're happening the most, right? 70% of cardiac arrests at home, that's a big number. We also know that for average response times in South Carolina for some emergency vehicles like fire trucks, like ambulances, can range between that 7 to 10 minutes. Okay, and then the most sobering statistic is for every minute without CPR or defibrillation, survivability drops 10%. That's a sobering stat. From someone who survived it, you can't help but to think about that stat and what to do about it. And fortunately, a part of the reason why we're here today is we all believe that we can do something about it. We can move that needle and be a great example here in Columbia, South Carolina. So it is my privilege. I've been excited about this. I've been prayerful for this, for the City of Columbia, for Chief Holbrook and Columbia Police Department, for Prisma, and for HRTHUDL to come together to further equip those who protect and serve and who can respond quickest to the scene in our residential areas, in our communities. So we are going to be announcing equipping 300 first-line police vehicles here in Columbia, South Carolina, with AEDs, with the help of Prisma. This certainly sets a precedent, and I think it's going to take a village. I know that it will, and I think people will answer the call, whether that's individuals and businesses and hospitals. It's going to take everyone, and it's an exciting thing because, again, this can be a flagship example, and I'm fortunate to be able to be a part of it. Here's why that's such a game changer with Columbia police officers, because priority 1 police calls, on average, respond 1 to 4 minutes, and we know that for every minute without CPR and defib, survivability drops 10%. Well, guess what? If CPR and defib is performed in the first few minutes, survivability jumps to 70%. 70% is a huge number. That's my story. That's Caleb Carter and Zach Moore coming over to see what happened to me and responding quickly, courageously, knowing how to do it properly. So right then and there, my likelihood to survive jumped up 70%. That's the significance of putting AEDs in cop cars. And to close out, I ask everyone, whether that's someone listening through the video, if this is live streamed or will be recorded later, everyone here, I'm asking businesses, we're asking businesses to commit to Columbia. This is our goal, 300 Columbia Police Department frontline vehicles. The cost of an AED is $2,000. That is $600,000. That's a lot of money, but I think we can do it. I know we can. I believe that Jesus will open the floodgates for people who want to contribute to this. And he still performs miracles. I'm certainly an example of that miracle today. So we put together a QR code for those who want to contribute to this. This will link to a giving page with a fund for CPD AEDs. Again, I consider my survival a great responsibility, also a great opportunity. And this has been my home for a long time. I went to the University of South Carolina. I care about these communities. Everyone here pour their heart and soul into protecting and making Columbia and our citizens better. And I am just honored, thrilled, humbled to be a part of it. And I think a lot of good will come from it. So thank you all today.
It's hard to even respond to that. Getting to know Connor has been a privilege. you know, with all of us, we talk about it each year, you kind of reach a point when, myself included, when you have certain health issues and you tend to be more private and you have to come to that point of recognizing that sometimes your story and your voice resonates with others. And when you're at that point to share, not only has Connor reached that point, he's taken it to a whole nother level of advocacy and bringing community together. And so we certainly have to give him another hand for that. I want to welcome Chief Holbrook to the podium to give remarks, and I know he's going to reiterate the benefits of this partnership.
Thank you, Ms. Wilson, and Connor. I haven't been standing there making faces. I've been biting the side of my mouth to keep from wildering away over there. As a father and an athlete, I can't imagine what that day was like. I totally get your emotions following that. You shared that with us a few weeks ago when we first met, and it was just as raw today to listen to you say that. It's just I feel so incredibly blessed that one that I have the privilege of being a police chief in Columbia, working for Ms. Wilson, but to be part of a program like this that is bigger than all of us, and it will absolutely save lives. And if I can put it in a little bit of perspective for you, you know, this is not something that we even, you know, have been considered years ago when you talk about police and what we do, but boy, how times have changed. I mean, all our officers now get trained in what we refer to as tactical first aid. They carry tourniquets to stop bleeding. They carry Narcan to respond to overdoses. And now, and with all those, there's not almost a day doesn't go by while we with no fanfare, very lackluster, we save lives. It's just what our officers do, and this is going to elevate that beyond comprehension, in my opinion. You know, we respond to 175,000 calls for service a year. That's our response. That's somebody calling wanting the police to respond. But every officer has a police car, so when they're not working, they're coming back and forth, traveling through, you know, the whole Midlands area in Columbia. They're working secondary employment, off-duty jobs. You know, you've all been to a grocery store or Walmart, and something you see a police officer. They're in our soccer fields with the children. They're in the basketball courts, in the football stadiums. The presence you see from our police officers is really staggering if you really think about all the touches that we could have. And the fact that we will have this training and this equipment in our car is going to be just remarkable, in my opinion. And I know that when we're standing here next year, celebrating this month, bringing awareness to this important issue, that we are going to have survivor stories to share, and that's going to be powerful. And I'm just I'm so thrilled to be a part of this, and I'm honored that that Columbia can start what I hope is something that just keeps spreading throughout our state. We really like to lean into innovative ideas, and this is certainly doing just that. We will make you proud, and we are all about saving lives, and this is absolutely going to save lives. Thank you.
Well, in closing, we encourage all of you to consider the HRTHUDL collaboration with the City of Columbia and the City of Columbia Police Department. We will be putting out widely the opportunity through the QR code and other collateral that's being developed right now the information on how you can give, how you can donate. In particular, we know our business community, and we've had some conversations already with our chamber and other business owners, that is a real easy, I think, opportunity for giving in a community that I know our business owners love so much. And we're just going to put it out there, y'all. We're going to encourage everyone, whatever small amount, to get to the $2,000 number for an AED, whatever your contribution may be, or if you're able to donate the full amount towards our 300 cars being equipped, we would be so very thankful. So I want to also talk about, we told Connor that, we are going to put him to work a little bit too with us. So we know the month of February and this year, even into the beginning of March, that we like to have fun with this too. And so I want to go ahead and talk about some of our upcoming events where Connor has already committed to participate. And one upcoming event is our Jumpstart Your Heart Day Party. We did this last year, and we're doing it again this year on Saturday, February 21st. But this year, from 11 a.m. to 1 p.m., we will be at the newly renovated Finley Park. So we're excited about that. It's all about raising awareness around heart health and encouraging our community, again, to take small proactive steps toward a healthier lifestyle. The event will bring our community together through fun, movement, and education. Little football, if I can guess, will be in the house while highlighting the importance of heart-healthy habits. Heart disease continues to impact families across our community, and events like this will help spark conversations and promote prevention. I think Connor made a great point about children not being afraid to express their emotions and what they're feeling or what maybe they need help in understanding. So we want to do that in an environment that makes it comfortable for them as well. We're excited to celebrate heart health together and thank our partners and attendees for showing up today and prioritizing their well-being. Our next activity will be the City Manager's Go Red Walk. Last year, we walked from City Hall to the State House. This year, we're going to be walking from Main Street to Finley Park with some fun at the end. That'll be on Friday, March the 6th at 10:30 a.m. And another opportunity for the community to walk alongside city leadership to raise awareness about heart disease, highlighting the importance of heart health, especially for women, and I'm a survivor myself, connecting participants with local resources and information. By coming together, we're showing our commitment to promoting healthy lifestyles and supporting heart health initiatives in our city, and again, reminding the awareness, education, and community action can make a real difference. So I'm really thankful Connor has committed to walk with us as well, and we look forward to many other of our community members. I know Councilwoman Cooper walked last year, so I hope she can attend again as well. And we're starting today with our t-shirt for that walk, the t-shirt campaign to raise money as well. This is the design this year. I don't know if we have one shown, but we're really thankful to our sponsors for the t-shirt and the walk, Founders Federal Credit Union, Palmetto Apparel and Embroidery for Citizens Bank, and Jabber and Isaac PA Law Firm. So we're so thankful for our partners. Can't say it enough. And at this time, if there are any questions, we can take questions. And if not, we're gonna get instructions on taking our photo.